Are you taking overdose of the thyroid medication? How do you know that? Thyroid medicine is in fact the most commonly prescribed medication. But many of the times people are taking wrong dosage and overdosage without them actually knowing about it. And due to that, their body undergoes into lot of symptoms which are indicating of this overdosage. But how do you know whether you are taking overdose or not? That's what we are going to learn in today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. Now before I continue this video, one important information. If you want to watch this video in Hindi language, then above on the I button and below in the description box there is a link. If you click there, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करते हैं तो इस वीडियो को आप हिंदी भाषा में पाएंगे. See, thyroid medicine, what we are talking about today, that is a levothyroxine. And this levothyroxine is a very commonly and routinely prescribed medicine to treat hypothyroidism, or what we call it as underactive thyroid. Here your thyroid gland is working little less than a required capacity, and that is the reason why we are replacing the thyroid hormone in the form of a pill, and this is called as a thyroid hormone replacement therapy. This thyroid hormone replacement therapy is one of the most safe and effective therapy, and does not give you any kind of an issues. However, if you do not take the dosage in a correct way, then in that case you are going to get a overdose or a over medication. And if you take the over medication, your body can have a various different kind of symptoms. What are those symptoms? Let's find out. So see, the symptoms can vary from person to person, but more or less the broadly what symptoms are there. So you might have a difficulty in concentrating, you might have a memory impairment or a forgetfulness. You can have a disturbance in your sleep also. It might be difficult for you to initiate sleep and stay asleep. You can even have an insomnia. Many people also have a mood fluctuations. Sometimes they can be depressed, sometimes they can be overexcited, overstimulated. Sometimes people also have a anxiety issues also. Many of the times the person feels that their body is becoming very sensitive to temperature. In spite of the chillest and the coldest of a temperature, they still feel hot. So heat intolerance is there, excess of a sweating can be there. You might find that you are losing weight. In spite of eating more and more, you are not gaining weight. If you are a woman, you might find that you are having a difficulty in your periods, your menstrual cycle is becoming irregular, and if you are married and trying to conceive, you might find it difficult to conceive and have an infertility problem. Whatever food you are eating gets digested very fast, and because of that, you might feel fatigued and are tired and increased appetite also. You might have a loose motions or a diarrhea on and off. Sometimes you might find that your heart rate is more, your blood pressure is more, the way you breathe, your respiratory rate can also be increased. You might find that when you're taking a heartbeat, you might find that it is a skipping. So this skipped heartbeat or a arrhythmia can also be present. So these are the certain symptoms which can happen if you take an overdose of the medication. Many a times what happens that the patient comes back in the follow-up to the clinic and they say that, doctor, after starting the medicine, I'm not feeling best of myself. And it might be possible that it could be due to the overdose of the medication. Only when we do the blood test, we find out that in fact you are taking an overdose of the medication. Many of the times, the symptoms which I just now explained to you are also very mimicking to a hyperthyroidism, and many of the times people get confused that now they are having a hyperthyroidism and not hypothyroidism. Remember, it didn't happen because the disease changed, it just happened because of the wrong dosage of the medication, right? So why does the overdose or over medication happen? This is very important, because if you know why it is happening and if you correct that, you will be saving yourself from any of the symptoms which I just now explained to you. So what are the reasons of this overdose? The very first reason is the trial and error method. Yes. See, what happens that when you have a thyroid problem, many people try to self-medicate, especially when they know about thyroid health. See, what happens, the thyroid problem are many of the times are familial. So it runs in the family. So let's say one or two family members have a thyroid problem and they are taking a medication. So the entire family becomes very confident in taking this medicine on their own. And many of the times the thyroid patient, they themselves start giving advice to other people that you have a thyroid problem, please take this XYZ dose. And this kind of a self-medication and a trial and error kind of a dosage cannot be right for you. And it might cause the overdose of the medication and you will land up into all the symptoms. So this is one of the most common reason of a overdosage. The second reason is that the medicine dosage. Yes. See, what happens that this is actually a practical error which we see in a clinical practice. Many of the times, let's say a doctor has given you one fixed dose. Let me give you an example, a 12.5 microgram. And doctors asked you to take this medicine. But when you went to the pharmacist store, the pharmacist didn't see the prescription carefully and dispensed you 125 microgram, which is 10 times higher than your prescribed dose. And if you also didn't pay a complete attention to it and you took the medicine and now you are consuming on a day-to-day basis. So in fact, you are taking the overdose of the medicine. So when you go to your doctor next time, you will say that, doctor, I'm not feeling good. And that's when we will find out that the dosage what you're taking is the wrong dose. So this is again a second commonly practical mistake. Third is a change of the dose brand. Yes. See, what happens, because this thyroid problem is a long-term problem, people keep a storage of a long-term medication, or sometimes they want to try different companies' medicine and they want to try their formulation. But please understand, this trial does not help when it comes to these medications. So do not do a trial kind of a methods with this kind of a medicine, and don't keep changing the brand, because every company has a different way of manufacturing. And if you change the manufacturer frequently, it is very high likely that the medicine which you are going to get will also be of a different potency. Similarly, many a times a different batch of the medication can also have a different potency. So if you are taking a medicine dose or a particular batch which is highly potent than the other one, then again you can have an issue with your dosage and the medication can become an overdose. So make a note of that. This usually happens when the person is taking a generic medicines. So when you take a generic medication, this change of the potency is very common. And that is the reason why we always tell the patient that please stick to the same brand as much as possible. Another problem of a over medication can happen is a change of the formulation. Yes. See, levothyroxine is available in a pill form. But in many countries, especially out of India, there are many countries where we have a liquid and a gel preparation of the levothyroxine. And this kind of a change of the formulation can also change the absorption rate. So if you are taking such kind of a different formulation of the medicine, or if you are changing the formulation, then also the overdosage of the medication can happen with the similar dose. Another reason of over medication is a change of a diet. See, if you are taking a very high fiber diet, in that kind of a situation, the thyroid hormone medicine will not absorb to a greater extent. So suddenly you change your diet from a high fiber diet to low fiber diet, your body will absorb more medicine and you will have a more symptoms due to the overdosage. Similarly, if you were taking a coffee and a tea with the thyroid medicine, now you have stopped taking those caffeinated drinks, and then you are taking the medicine, again the overdose can happen. So this is a dietary change. Similarly, there can be a supplements. Yes, many people take a supplements, and these supplements are available in the market in the name of a thyroid support, adrenal support and whatnot. All these supplements, they claim to help you in your thyroid balancing. And many of the times, this support kind of a medication also contains some formulation of a levothyroxine. And when you take that, in fact, you are increasing the thyroid functioning, and that can happen due to the overdosage. Similarly, there is an iodine supplement. Many thyroid patients think that they should take iodine supplement. And when you take iodine supplement, this iodine supplement increases the thyroid activity and can trigger a hypothyroid kind of a symptoms. So again, make a note of that. Similarly, many times, many patients take a supplements of an iron medicine or a calcium supplements, or sometimes even the acidity medication. Those also interfere with the thyroid medication. So if you are taking such medication and suddenly you have stopped it, the absorption of the existing medicine will suddenly increase and your body will go into the overdosage. Similarly, there can be a condition like a pregnancy. See what happens during the pregnancy, your need of the medication increases. So during the pregnancy, if you are taking the dose, it might have a different absorption and you might need to change your medicine. Similarly, there is a medicine like an oral contraceptive pills. Now, these oral contraceptive pills contains estrogen and progesterone. These contraceptive pills are taken by many married women and also by women who are suffering from a PCOS or a polycystic ovarian syndrome. So when you take these oral contraceptive pills, the absorption of the thyroid medicine is different. Suddenly, when you stop these medicine, you might find that your body is absorbing this levothyroxine more and you are going into overdose of the medication. Similarly, there is one more medical condition called as a Hashimotosis. Now, what is this Hashimotosis? This is actually a variant of a Hashimoto's disease. See, hypothyroidism, which is the most common reason for a thyroid imbalance. And this hypothyroidism happens due to autoimmune disease called as a Hashimoto's disease. But sometimes this Hashimoto's disease person can have an unpredictable functioning of their thyroid gland. Suddenly their thyroid gland is working more and overproducing the thyroid hormone. So if your gland has gone in a toxicosis stage, and at that time, if you are taking the dose which you are routinely taking, in spite of that, the thyroid hormone, because production is more in your body will go into the overdose of the medication. So these are the reasons which can cause an overdose of the medication. So what is the best solution? The best solution is that you keep checking your thyroid function test on a regular basis. Especially when your dose is changed, especially when you have changed your formulation, especially when you are pregnant, especially if you have changed any of the medication, or if you have changed the formulations or a brand. So if you have done any of the changes, you must check your thyroid function test on a regular basis to find out whether you are on overdose or not. Alright. I hope after watching this video, you got some good useful information. If you are new to my channel, please don't forget to subscribe so that you get more and more health related information, especially diabetes, thyroid and hormones. If you have any of your personal question whose answer you are seeking for, write your question below in the comment box. I try to read and answer them as early as I can. We will meet again with some new good useful information. Till then, take care of yourself. Namaste.